Today we are going to study anatomy of the spinal cord, in which we will study the external anatomy, the cross section of the spinal cord, ascending and descending tracts, meninges and spaces, blood supply of spinal cord, segmental origination, major functions of spinal cord, and clinical correlations. Basically, the diseases that occurs. Okay. First of all, we will study external anatomy. Spinal cord basically starts from C1 and it is the continuation of medulla, which the point is called foramen magnum, and ends at the level of usually L1 and L2. That is called Conus Medullaris. It can also extend up to the coccyx, and there it is called Filum Terminale. Usually the length of spinal cord is 45 centimeter in adults. Okay. And about the surfaces, interior midden fissure and posterior midden fissures are present. If we will see it in cross sectional of the spinal cord, it has interior ventral and posterior dorsal sides. Okay. So it will have the interior horns and the posterior horns. These are two interior horns, this and this one, and these are two posterior horns at the dorsal side. And likewise, these are lateral horns. Okay. And there is a central canal in it. Posterior horns basically contains two fasciculus, that is fasciculus gracilis, that is medially, and fasciculus cutaneus, that is laterally. That is this is fasciculus gracilis and this is fasciculus cuneatus, that is laterally. Okay. This is the posterior dorsal root ganglion. This is the dorsal root, and this is the ventral root that combine to form the spinal nerve, mixed up basically. Okay. Now the meninges. First of all, there is pyometer leptomeninges, that is adherent to the cord. Then there is CSF around it in the subarachnoid space. Then there is arachnoid mater, dura mater, and epidural space. Okay. Ascending tracts. We have three ascending tracts basically. Number one is dorsal columns. As I have seen, you have seen that there is gracilis and cuneatus. This is the gracilis and cuneatus, and location is posterior funiculus. The functions of dorsal columns are fine touch, vibration, proprioception, conscious position. Gracilis basically controls the lower limb. You can just remember it by that there is a gracilis muscle in the lower limb, so gracilis is controlling the lower limb, and cuneatus is controlling the upper limb. Okay. Then there is spinothalamic tract. Spinothalamic tract, the location is anterior lateral funiculus. Spinothalamic tract is here basically anterior lateral funiculus, and it controls pain, temperature, crude touch. And third is Spinocerebellar Tract, that is present dorsally and ipsilateral and ventral double cross. The function of it is unconscious proprioception to cerebellum. Then there are descending tracts. There are 5 descending tracts: lateral corticospinal tract, anterior corticospinal tract, vestibulospinal tract, reticulospinal tract, and rubrospinal tract. Now, lateral corticospinal tract and rubrospinal tract are located in lateral funiculus. Anterior corticospinal tract, as there is a name anterior, and reticulospinal tract both, and vestibulospinal tract, all three are located in anterior funiculus. Now the functions. Lateral corticospinal tract control voluntary movements that are fine scale of basically distal limbs. And anterior corticospinal tracts control voluntary movements of axial muscles. Vestibulospinal controls balance, posture, and extensor tone, whereas reticulospinal control posture, locomotion, and muscle tone. Rubrospinal facilitates flexor movements. Now the blood supply. Spinal cord is supplied by anterior spinal artery, only one anterior spinal artery basically, and two posterior spinal arteries, one anterior and two posterior spinal arteries, and subsegmental medullary arteries. And the main artery which you have to remember, that is the artery of Adamquist, that is the branch of greater anterior radiculomedullary artery and supplies the lower two-thirds of anterior spinal cord. Now there are 31 pair of spinal nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Remember it with the vertebra. Major functions are, as you have seen above, control, motor control, sensory transmission, reflex center, and autonomic functions. Clinical correlations include Brown-Sequard syndrome, that is hemisection. Ipsilateral loss of vibration, position, and motor function occurs, whereas contralateral loss of pain and temperature occurs. Anterior cord syndromes, bilateral loss of motor and bilateral loss of pain and temperature occurs, whereas vibration and proprioception are spared. Central cord syndrome, loss of motor, upper limb and lower limb, all the loss of motor system occurs. Loss of pain and temperature, only vibration is present. Tabes dorsalis, degeneration, loss of vibration and proprioception, positive rhombic sign, ataxic gait. Syringomalacia, loss of pain and temperature, there is cape-like distribution, and motor may be spared early. Then these are some of the mnemonics that will help you remember. So this is all about the spinal cord, and hope it will help you guys. And you may take a screenshot of it so that you can just revise it.